Hello everyone and welcome back. In this video, we will do a beautiful combo of body treatment with the cavitation radiofrequency device, and we're gonna do the two-in-one, the LED light therapy plus oxygen infusion dome. So in total, I will be using 3 devices and I will be covering all the body and face areas together. Let's start with placing up our dome first. I have 2 devices, as I mentioned. I have the oxygen concentrator that produces the pure oxygen flow. So this device will allow me to achieve 93 to 95% of pure oxygen flow. I'm placing it right on top of my client's face, right here. There is a tiny opening, if you can see from this side. This is the exhale opening. So when she will be breathing, the warm air will lift up. So to avoid the cloudy surface in the dome, the air will go through this opening, and then the cold air will go down there to the skin and lower. Number 1 step is already ready. Then what I will do, I will turn off the oxygen. With the oxygen dome, you always want to adjust the flow. So how many liters per minute your device will provide to the dome. I will do the maximum concentration. Okay, 1 second. So I'm using 1 liter per minute. So it's going to be very, very gentle flow, but my concentration of the pure oxygen molecules will be 93 to 95. The higher the concentration, the higher the percentage, the more benefits of the oxygen you can receive. In this case, I will address acne and inflammation on the skin because acne bacteria, they are anaerobic. They don't like oxygen in their everyday survival. So I want to add as much oxygen as possible to reduce inflammation, acne, and also to regulate the sebum production by the pores. My next step will be to add the LED. I will be using the LED dome right here. So I need to start it. Select the light. I will do both. I want to use red and blue. So it will switch from red to blue. There is also an option of the infrared light. Infrared light is the deepest wavelength. That is about 840 nanometers. It can reach to the dermal layer of the skin and stimulate collagen production, boost elastin, and overall create the anti-aging effect. I need to adjust my time. I want it for long, 20 minutes. And my intensity, I have the intensity range from 1 to 3. I use max, I use 3. So I have 2 lights working simultaneously, blue and red. I have the oxygen going. If you can hear the breathing sounds of the oxygen concentration device, it's generating 93% of pure oxygen. So I'm receiving triple action simultaneously. Oxygen, pure oxygen infusion. I have the red LED, which is 640 nanometers, which will also help to boost collagen and elastin production, will create the anti-aging results and rejuvenate the skin. And the blue light, which is the shortest wavelength, which is 430 nanometer, it addresses the acne as well as the oxygen too, and it also reduces potential inflammation or redness. So I have 3 actions simultaneously. As soon as my client is already set in here, I can go ahead and do my body portion, which I will be doing the cavitation to remove local fat deposits and vacuum radiofrequency to address the cellulite and skin sagginess, as well as stimulate lymphatic flow after I do my cavitation. In this treatment, I will be using my Zemitz Abigon Pro device. It's right here. So we will prepare the skin first and then jump closer to the process so you can see the technique and all the tips of how to do it in the best way. Okay, let's do our leg slimming treatment. I will use as a first step my low frequency ultrasound treatment. Low frequency ultrasound is also called cavitation. The whole concept of the cavitation treatment is to address the local fatty deposits in the precise area. So I'm not covering the entire body. I will select the treatment area. Usually it will be 6 by 6 inch area. I will apply the gel to conduct the ultrasound and then apply the specific technique of the cavitation treatment. My cavitation low frequency ultrasound will go through the gel inside the skin, will increase the pressure inside of my fatty cell, not mine, hers, and it will rupture the membrane in the most weak portion of it. So the internal liquid content will be spelled outside to the interstitial in between our cells space. So then the must-have step after cavitation would be to perform lymphatic drainage. That is why I'm going to use the radiofrequency and vacuum treatment to accelerate lymphatic drainage, to speed up the metabolic processes, and also to tighten up the skin. Let's start with the cavitation first. So first of all, I would need to apply the gel. I am using the Fermingenius peptide gel that is filled with peptides, and it will also help me to generate more collagen fibers. So this gel can stay on the skin, there is no need to remove it after. I will be, for now in this treatment, I will be focusing on this front area of the thigh. Thick layer of the gel. You will reapply gel during the treatment because the skin will absorb, and then you will spread it also with the handpiece. Cavitation, low frequency ultrasound. This handpiece uses 40,000 vibrations per second, which is pretty low. The lower the frequency, the deeper my power can go. I'm staying in the 40K because I'm treating the front side area. If I would be treating the back thigh, or if I will be eating the buttocks and I need to reach deeper layers of the fatty deposits, I can reduce the frequency on this machine to 30K, to 30,000 vibrations per second. For now I'm good with 40, so I will stick with this frequency. So I need to select cavitation on my screen, and then I would just need to set up the time and the intensity. I would select the intensity of 6 out of 10 to make sure it's not too much, but still effective enough so my client can see the results right after. So on my screen, I can adjust the intensity up to 6. There are also some modes. Mode is the specific program of how the ultrasound will go. It can be the pulse mode or the continuous mode. The longer the pulsation, the deeper the treatment, the deeper the ultrasound can reach. I will use mode 1. It will be pulse mode, so I will have a short periods of relaxation between the ultrasound penetration into the skin. Okay, the treatment time. Usually cavitation lasts about 30 minutes per treatment, depending on the area when it's applied. If we are talking about the thigh area, I will do it about 30 minutes on both. So I will do it 15 minutes on one side and then 15 minutes on another one. So I can preset it on my device, make sure it will pass when it no longer needed. 15. Intensity 6, reminder, program 1, the pulsation mode, and 15 minutes. I press start. You see the timer count down, so the time is going down. I do not hear any ultrasound sound, and this is typical for the proper cavitation. So the proper cavitation is the low frequency ultrasound. You cannot hear it unless it's being activated. The activation means it needs to be in contact with any contact medium, which is either water or water-based gel. So what will happen right now, my client will experience a tiny vibrations on the area when I will apply it, and also she will hear this specific buzzing noise inside of her head. This is the classical sign of the proper cavitation. Your client always will feel this sound inside of the head, a little annoying, but this is the sign of the nice cavitation that definitely will bring you to the good results. So applying the wand, the cavitation wand to the skin. No sound, which is good. If you will be quiet enough, you can hear like a little bit of vibrations on it, but it's very light. Most sound goes to your client, so she will hear the sound. What the technique? This is a very interesting question. The technique of cavitation. You need to apply cavitation only on that areas where you have the local fatty deposit that you can address. You cannot expect skin tightening of the cavitation, because ultrasound in the low frequency can perform only local fatty deposit removal. So to make performance more effective, you need to use your free hands, the one right here, and push the skin fold towards the handpiece. My hand that holds the cavitation wand, I'm using compression, so I'm pressing into the skin, and I'm trying to create this fold between my free hand and the handpiece, and focus the ultrasound right in the fatty layer. Circular motions, gliding, not too fast, not too slow. Don't stay in one spot, and cover very small areas simultaneously. So you're not trying to cover too much of the skin. I'm trying to focus on this particular area. If you can see, gel is already being absorbed, so you would need to reapply it. And on the all duration of the cavitation, that will be 15 minutes on one side, you would need to ensure you are creating this fatty fold with your free hand in cavitation. You're using circular motions, and you have enough amount of gel. Mine is not, so I need to reapply it. You also can check up on your clients and to see if they feel comfortable enough for this treatment. Sorry. So if you can see, I'm using both of my hands, and I tilt the cavitation wand so I can focus the ultrasound waves inside the fatty fold. Thighs are very actually easy to perform the treatment. You would need to be more cautious while doing it on the abdomen, as you don't want to direct it like this on the abdomen. You always want to create this fatty fold. And use the circular motions. I can hear the vibration just a little bit. All the sound is for my client. She hears it inside of her ears. 15 minutes gliding motions. Again, you should prepare your clients how it will be felt. The pressure is moderate, so I'm not too gentle because I really want it to work. So I'm applying the pressure with my wand, plus I'm pushing the tissue with my free hand, and she physically experiences like a compression massage sensations. Plus, she feels the ultrasound and she hears the buzzing noise. There are a few tips of how to make cavitation more effective, and some of them would be, you would need to recommend your client to avoid carbs intake 2 hours before and 2 hours after the treatment. You would also ask them to drink about 1 gallon of pure water on the day of the treatment. And you would ask them to exercise additionally after the treatment is being performed. Even though you will perform the lymphatic drainage massage after to stimulate lymph and detox, you would still want to ask them to do additional activity, jogging or exercise, gym, anything, so they can engage their natural processes in the metabolic, to speed up the metabolic processes. So carbs can be also used naturally, except just targeting the fatty cells in here. Very easy treatment. It's very popular. People charge about 100 to 180, sometimes 200 per one treatment per area. But it will always include the lymphatic drainage that after, in the majority of cases, you will also incorporate the radiofrequency intake. So when cavitation addresses only the fatty deposits, fatty cells, radiofrequency can also trigger the collagen production and can tighten up the skin. So you will receive less circumferences and tighter skin with the combination of cavitation and radiofrequency. Few other recommendations with the cavitation: make sure you have gel, make sure they drink lots of water, make sure they don't eat 2 hours before, 2 hours after, either at all or just not eat any carbs. And another thing, while doing the treatment, make sure you do not direct your cavitation wand into the joints or bones. So you can perform cavitation only on the areas when you have unwanted fatty deposits. This is not safe to do it on top of the bones or joints or cavity. So when you are doing it on the abdomen area, always make sure you have this nice fold between your free hands and your wand. So you are addressing your cavitation into the fatty fold. Another point to discuss is that the time of the treatment. Usually, in the safety precautions, it's not recommended to exceed the duration time of 1 hour per the entire body during the week. So you can do either one time per week, one treatment, which can last up to 1 hour, or you can do 30 minutes and then another day 30 minutes. It's not exact, it's just the average duration, and it's simple safety precautions, just to not overwhelm the body with the ultrasound exposure. If you're staying in these ranges, it's completely safe, and if you're using the nice technique when you are applying it through the gel, when you're gliding it, and when you are focusing on the fatty fold, then the result would be great. It will be safe, your clients will be happy to receive less circumferences again, because it's slimming and it's reducing the deposits of the fatty cells. So after the cavitation is over, you can clean out the area from the remaining gel, or you can leave it. In our case, it's beautiful peptide gel, so I will leave it on the skin, and then I will come up to my next step, which will be the vacuum radiofrequency.